So I am a Professor of Paediatric Oncology at the university, and I work as a paediatric oncologist at the Birmingham Children's Hospital. In my hats at the university, I'm director of the Cancer Research UK Clinical Trials Unit. And our clinical trials unit is the national trials unit for childhood cancer trials. And the challenge we face in paediatric oncology is that childhood cancer is rare. Now, in some ways, that's not a challenge. It's good that not many children develop cancer. But the number of different cancers that children get is very diverse, and they are not mini versions of adult cancers. They are unique diseases that happen in young children with a very different reason for developing. And the treatments have basically been, if you like, hand-me-downs from the adult world up to now. We use really toxic chemotherapy drugs, surgery, radiotherapy in children that were really originally developed in the adult world. And so the challenge we have is that the toxicity that children experience because of this treatment not only impacts on the time when they're on treatment, and therefore it impacts on their development and their school lives, but also a third of children that are treated for childhood cancer go on to have long-term side effects that have an impact on the way they live their lives in the future. So what we're trying to do is develop new treatments that are not only effective, but have less side effects in the future. And the way to do that is to have a better understanding of the biology of childhood cancers so that treatments can be more targeted. But when you try to translate the work that's being done at the bench into clinical trials in children, we have to recognize the numbers of patients are small. So to get good scientific evidence, we need to do collaborative research. So nearly all our research is international. 98% of our clinical trials that we run for children involve other countries. And also we have to design them in a very innovative way. And we're very lucky in our trials unit to have incredibly innovative statisticians that design trials that answer research questions with the smallest number of patients possible. So that we can get to the answer for the improved treatment for children at a much earlier stage in a drug development. And we're now working on some really quite innovative models, partnering with industry. Industry haven't been interested in children with cancer because the numbers are too small for them to be economically interesting to large corporate organizations. But we're finding innovative ways to work with them so that we can deliver the trials in partnership with industry, such that the research questions can be answered for the benefit of patients, and the data can take those drugs into licensing into the NHS at a much earlier stage.